Hello and thank you so much for joining us on Business Now, where we share details of financial happenings in the past week with you. My name is Chinaemerem Joseph. Welcome. Now, the International Monetary Fund has advised commercial banks to retain their earnings by suspending payment of shareholders' dividends during the COVID-19 pandemic. The IMF Managing Director, Kristalina Georgieva, made the call in an opinion article entitled "Halt Bank Dividends and Buybacks Now," posted on the organization's website. Georgieva said retaining earnings through suspension of dividend payments would provide banks with enough capital to serve as a buffer against the adverse effects of the pandemic. She pointed out that after the 2008 global financial crisis, regulators required banks to increase their prudential buffers of high-quality capital and liquidity. The development, according to her, strengthened the resilience of financial system. Now, there is a caveat. How well would shareholders digest this move, even though one expects these shareholders to have an idea that businesses have also been hit badly? However, some other people believe that some businesses are making huge profit despite the pandemic. And then another trending business story is the meeting by the Monetary Policy Committee of the Central Bank of Nigeria. The decision on basic policy parameters would be made and then announced by the governor of the Central Bank of Nigeria, Godwin Emefiele. The chief executive of TalkHealthNiger.com, Dr. Laz Eze, would also be joining us on the interview segment to discuss how much the COVID-19 pandemic has affected the economy of the health sector. Let's take a break here. When we come back, we will share some stories from the newsroom with you. The Monetary Policy Committee of the Central Bank of Nigeria actually met on Thursday, where they would be deliberating on whether or not to adjust, retain, or hold some very basic policy parameters. Now, the members of the committee have been meeting in the nation's capital, and we'll be joining the governor of the Central Bank of Nigeria, Godwin Emefiele, to give us details of the decisions that have been reached. The Central Bank of Nigeria has reduced its monetary policy rate to 12.5% as part of efforts to combat the economic effects of the coronavirus pandemic. The previous rate was 13.5%. However, the bank retained its cash reserve ratio at 27.5% and liquidity ratio at 30%. The monetary policy rate is the interest rate at which the apex bank lends to commercial banks and also the benchmark against which other lending rates in the economy are pegged. Mr. Emefiele added that the asymmetric corridor around the MPR will remain at plus 200 minus 500 basis points, while the cash reserve ratio will remain at 27.5% and the liquidity ratio at 30%. The committee also considered developments in the global and domestic economy since its last meeting, including the negative impact of COVID-19 on global growth and the responses of global central banks to the pandemic. And that's all we'll be taking from the newsroom for now. We'll go on a break, and when we return, the chief executive of TalkHealthNiger.com, Dr. Laz Eze, will be our guest on the interview segment to discuss how much the COVID-19 pandemic has affected the economy of the health sector. Do join us again. Thank you so much for staying with us on the program Business Now. It's actually time for our interview segment now, and the chief executive of TalkHealthNiger.com, talking about Dr. Laz Eze, would be joining us now to discuss the impact of the COVID-19 pandemic on our health sector, and of course we'll be beaming our searchlight on how all this relates to the economy. Okay, thank you so much for joining us, Dr. Laz.
Thanks for having me.
You're welcome. Now, the whole pandemic kind of took all of us by surprise. Life was normal.
Yes.
Even though it started in China in December. But January, February, we had a very normal life back here. And it was just like suddenly the virus came into Nigeria and started spreading across the states. How would you be describing the level of impact, or how badly has the virus hit the health sector? Also taking into cognizance the economic aspect of this hit in the health sector.
Well, the COVID-19 has actually hit every aspect of our lives, every sector of the economy. But speaking specifically to the health sector, it has stretched further, our weak health system. We've been struggling to deal with a whole lot of health conditions with very high burden of disease. We are number one in malaria in terms of the highest burden in the world. We are about number 4 or 5 in tuberculosis. Number 2 in HIV and all that. So we've been struggling health-wise. Our health sector has been so neglected criminally, if I must use that word, in the past, for many years ago. So COVID coming in to get everyone in an emergency situation for a very long time has huge consequences. And to make this very much clearer, people who have other health conditions, their access to health care has been reduced. Yesterday I was speaking with a cancer patient who struggled to raise funds for her treatment. She's receiving treatment at the University of Nigeria Teaching Hospital. And she was telling me that since February she was to receive radiotherapy for 4 weeks. She just had 2 doses and they couldn't continue. And she was scared for her life because she's having pains, she has done so many tests and all that. She can't really explain why her radiotherapy treatment couldn't continue, and they told her COVID-19 and things like that. And my colleague also told me about a cancer patient that went for treatment because he had high temperature and all that. They took him to an isolation center and he was shouting, no, it's cancer, it's not coronavirus. And before they could do all the protocols and all that, the man died. So these are some other consequences we are having, but because nobody is tracking these numbers, so we can't really put a number to it of how many Nigerians are having these experiences of having difficulty in accessing healthcare because of the effect of COVID-19 on our health sector.
So are you trying to say that, the health sector being overstretched right now, could we also be blaming it on the gap that has been created by funding? Now, we've had a lot of health issues to deal with, and then the coming of COVID-19 has also added, to the burden of the health sector. So could we be blaming the funding gap that has been created, coming from the government in terms of budgetary allocations and then even the support we get from the private sector? So it seems the funding gap is really too huge.
Yes, the funding gap is huge. Yes, I blame the funding gap, but that's not the only reason. There is a combination of a lot of gaps, a lot of factors. So yes, the funding gap has been huge. Our national budget has been roving around 4 to 5%, that goes to health. That's budgeted to health, and not even all of them are released. And sometimes not all the released ones that are even spent. Sometimes the release come very late in the year. And this is even a budget that has more than 60% of recurrent expenditure with very minimal amount for capital expenditure. So funding gap, and it's not just what's happening at the federal government. At the state level, they don't have, many of the states, I doubt if I know of any state that has line budget for health security to prepare the state health system for situations like COVID-19 or Lassa fever or monkeypox or meningitis. Even malaria, as common as it is, many states don't put a line budget for capital projects in the control of malaria outside payment of healthcare workers. So the health sector really suffered criminal neglect. Yes, the private sector too hasn't done as much as they should before now. We could see with COVID-19 there are a lot of donations from corporate organizations. And I know since 2 years ago when the National National Health Security Plan was adopted in 2018 with a budget of over 130 billion naira. National Center for Disease Control and other partners have been appealing to government to increase its funding, appealing to private sector to make donations, do their CSR in support of national preparedness towards health security. I didn't see any significant investment or response from the organized private sector to that call, not until COVID came and closed down businesses and kept everyone at home, and we started running helter-skelter. So one of the lessons we should take in this is health is not just a social good, it's not charity. Health is security, health is economy, health is our life. And when we begin to consider, we don't need to box health into one corner. Even in our national discourse, where we are talking politics, the health should be at the center as well. We are discussing the economy, health should come in. Health can contribute significantly to our national GDP and also lifting people out of poverty. It can create more jobs. It can, hope to preserve our currency, because the amount of money that leaves this country on medical tourism, if we spend them here, if we strengthen our hospitals, and if we also provide enabling environment for the private sector, to invest more in the healthcare business. And because most of the hospitals in Nigeria go outside, they are not government hospitals. They are private hospitals. So why are they not being built here with the level of money that Nigerians take outside the country? So we can do it here if government provides enabling environment, if financial institutions are ready to provide loans and all that, ease of doing business that will make people make such investments, and we spend those money here instead of taking it out of the country and further weakening the naira.
Doctor, but jokes apart, it's been a discussion in some places that maybe the medical practitioners are kind of smiling now, even though it's not a time to laugh, that a lot of our government personnel or officials have got to stay back in Nigeria to seek for whatever health assistance they need. But that apart, you are a practitioner in the health field. Maybe you should take us through what really is going on, or how the health sector is really trying to handle this pandemic. Give us a picture of what really is happening.
Well, what is happening now is we have a pandemic in our hands. We have more than 8,000 Nigerians who have tested positive. We have close to over 200 Nigerians, who unfortunately have lost their lives to this pandemic. And we have testing capacity that have increased from 5 laboratories to about 28 laboratories, within the past 2 months
we've just
for COVID-19.
And we've still just tested just about 8,000 Nigerians when we have over 200 million.
We've actually tested over 40,000 Nigerians at the moment. Okay. Yes, it's not enough.
Not even
yes, it's not enough. We could have tested more, but that's where we are. So the health sector is, trying to cope with the situation of handling this. A number of health workers have left their primary place of providing services and now working in the treatment centers for COVID-19. So, and we know that we have about 1 doctor to 6,000 persons, Nigerians, as against 1 to 600 that the WHO, World Health Organization, recommended. So Nigeria is like a factory for doctors and nurses for other countries. So the number we have is even small. But now we have a number of them who are no longer attending to other illnesses, but only COVID-19. So it has further taken a number of our human resource for health, including nurses, including cleaners, including laboratory scientists who could have been doing other tests as well, but now testing only COVID-19 cases. So it has further done that stretch. The health sector is trying to cope. It's difficult. Certain things can happen overnight, right? So we're now having a situation where a hospital that used to see maybe 200 patients in a day now cannot take more than 80, for instance, because they need to observe physical distancing, and some senior health workers in some hospitals are not even going to work because they don't have personal protection equipment and they don't want to risk their life, especially those who are 60 years and above. You know, so I've gotten such reports from some of our colleagues. So they just do phone call to younger colleagues because they don't want to put themselves at risk of, because there's nobody that writes COVID-19 in the person's forehead. So, and if they don't have PPEs and they are not testing like we have in Kogi and a couple of other states where testing is suboptimal. In fact, this report specifically came from Kogi State, where they are afraid that because testing is not being done. I heard that the state is already making efforts
but the update
to start testing.
The update that the NCDC provided Wednesday night, I actually saw that Kogi State recorded 2 confirmed cases. So it then means that testing has started.
Yes, as of last week, there was a period that the resident doctors at the Federal Medical Center, Lokoja, kind of said they are going to take their destiny into their own hands. So I learned the state authorities had meetings, and now perhaps testing may have commenced, but that delayed for too long. Everybody knew the story of NCDC officials, leaving Kogi when they were about to be quarantined for 14 days and things like that. So COVID has really overstretched our health sector. It's not doing as if it's going away anytime soon, so we don't know how long this is going to last. But the earlier everybody played their part, the earlier we adhere to the government instructions from the National Center for Disease Control, Federal Ministry of Health, and the World Health Organization, keep washing our hands, keep using face masks, especially when we are in public spaces, keep adhering to all the rules, the better for all of us. The earlier this COVID becomes insignificant in its contribution to the health or the disease burden, the better for all of us, so that we can now begin to, from the lessons we've learned, and see how we can be better prepared.
Now, Doctor, could it be that if we've so far tested about 40,000 citizens, could it be that a lot of people in their houses, we still go out for businesses, the markets are opened, in Abuja here 3 times weekly. Could it be that the market women, even the residents, those who are not sellers in the market, could have at one point or the other contracted this virus, and then it maybe got probably with high immunity, and it got healed at home, because now the feeling at the grassroots is that, like, when you get to the market and I get reactions, the market is loaded. Now, for the fact that the government has approved the market functioning just Mondays, Wednesdays, and Saturdays 3 times in a week. So at such period, especially on Saturdays, you have this huge number of people rushing into the market. Now, that's violating the one of the measures using to stop the spread of the virus, the physical distancing. And then I also got a report recently that a lot of people going to the market now are no longer wearing their face mask. Now, and then a lot of people are still struggling to believe that COVID-19 is in existence, especially those at the grassroots who haven't woken up some morning and heard the news of their neighbor, having difficulty breathing, or someone has died along the street and all that. So the feel out there is that this thing is not really there, and then people are also tied up, in a fix. Do I stay at home and don't go out to trade? How do I feed my family? How do I survive? So what would you be advising such people, especially those at the grassroots who are trying to come to terms with reality?
Well, there are a number of factors that may have played out on whether people believe it exists or not, or whatever perception people have about this. Perceptions are not always right, but you don't take them away because it informs people's action and responses. Personally, I feel we've not communicated enough. There's need for more effective communication. In a number of places, people that used to lie to Nigerian people or Nigerian citizens in the name of politics are the same people who are telling them about COVID-19. So they took it as one of those lies that those same personalities are used to telling them. The mistrust over the years, between the citizens and government came into play here. So what we could do going forward is improve our communication, invest more in that, especially as the economy will open. We can't keep locking down or restricting movement for life, because health and economy are intertwined. So if someone is hungry, if someone can't eat, the person could be traumatized mentally, and health is a state of complete physical, mental, social, psychological well-being and not just the absence of disease. So for a man that does not have 1 naira in the pocket and the children are crying for food, and such person cannot be said to be healthy. So especially as we get to open up for everybody to do their business, we must communicate effectively through multiple channels, using village communication channels, religious organizations, traditional institutions, people that are trusted, influential people at every level, to have this message, so that we continue to pass it. Because COVID, over 80% of cases will be asymptomatic. Asymptomatic means the immunity will fight it off. It will not even show anything, but it can still spread to someone else. We have the pre-symptomatic ones. Those ones are those who, if I get it today, and maybe it took me 7 days before I start showing symptoms, that first 7 days I didn't show any symptoms is a pre-symptomatic period. I can still transmit the virus, even though I'm not showing symptoms, before my own symptom begins to show up. And you also have the symptomatic ones, so which is less than 20%. And even among the symptomatic one, majority of them will not have the extreme of the symptoms. So it's just about 5% or thereabout that may have those breathing difficulties and things like that. So if people are saying, because they are not seeing pictures of isolation centers where everybody is on ventilator and looking as if they are going to die the next minute, that's why they are not believing it. No, they are probably assuming that everybody with coronavirus or COVID-19 is going to be hyperventilated as if they want to go the next minute. So, but that's not it. That's perhaps their understanding. So we need to educate more.
So 2 questions before we go. Time is almost up. We know that a lot of practitioners, whether traditional or the mainstream health sector, are trying to come up with some vaccine or some medication that can be used to treat the virus. So tell us, I'm sure a lot of people think maybe the traditional aspect, it could work, the vaccines that a lot of people are working on could work. But a lot of people are also looking at the economic aspect, that some people who are working on this are trying to also come up, if you can come up with what would be approved, because we hear that NAFDAC is also trying to work with some of them. If yours is approved, you make some money and put in your pocket. So how do you think that aspect is thriving in terms of looking for a cure?
Yes, I think a lot of persons have, from news reports, have sent notes to NAFDAC, because that's the institution of government that have to look at anything you have and approve it for human use, whether it's food or drugs or vaccines. You have to go through NAFDAC. So earlier people were going to media to announce that they had cure. There's no country in the world where drugs are approved based on media announcements. So there are protocols that it has to go through, scientific protocols that is applicable everywhere in the world for anything at all we take, because for every drug we take to cure a health condition, it's also potentially a poison. So what makes it a drug is, we know that if you take it in a particular dosage, it's going to cause more good than harm. There's another dosage you take it will cause more harm than good, right? So those trials and tests and processes is just to make sure that when it's approved, it's causing more good than harm, and that's exactly what I think should be done, and that's also what the government is saying. Anything you have, bring it on. It will be in the interest of our economy, and I think government should also invest more in research, support researchers, support those who are working in those areas to come up with more solutions. When our solution is local, it pays us economic-wise. It also pays us because we'll not be waiting for something to be imported and people are dying. So immediately is needed. It will create jobs. It will add to they will pay taxes. It has so much effect and good effects to us as a country.
So that brings me to my last question. I'm aware that the Central Bank of Nigeria has rolled out a number of interventions for the health sector, the pharmaceutical industry and all that, to take advantage of and then, go after this money, though it's a loan, but at a very reduced interest rates. I want to find out, your colleagues actually patronizing these loans, are they going after them? How much do you know? Or have you also, as a practitioner, have you also thought about it, going after the fund?
Yes, I can answer for myself. I've already started taking some steps towards that, and I think it's a very good initiative. What we usually complain, especially the private sector in health, is that it's as if the Nigerian system is not interested in supporting private sector health players, because no commercial banks don't usually give loan for you to set up hospitals or even do health interventions, and I don't know if there was any policy that says they shouldn't do that. So it's heartwarming that Central Bank of Nigeria made this available, and we're just hoping that going forward, even commercial banks and all the various financial institutions should begin to give these loans at a minimal interest rate, because Nigeria majority state pay out of pocket. Over 70% of health expenditure in Nigeria is out of pocket, so which means there is a whole lot of risk. So as we do this, there should also be universal health coverage. Every Nigerian should have health insurance. The 8th Assembly passed the bill. The president did not sign it. The 9th Assembly is attempting to pass the bill again. I think such bill should be fast-tracked and passed this year, and I beg that Mr. President please sign this so that every Nigerian will have health insurance. This money we pay out of pocket for healthcare, we can pay less, contributing to a larger pool, so that when anybody feels sick, even in emergency situations, you are not under pressure or financial difficulty to pay for healthcare. When we have universal health coverage and health insurance covering all Nigerians mandatorily, everyone should have it, then it's encourage people to come and invest in health, take the risk, invest billions of naira, provide the best possible quality of care, because they know that people will be able to pay for it. So it's going to help out all together, and we need to communicate this to the understanding of Nigerians, so that the citizens themselves will become advocates to make our hospitals work and make our health sector very much effective.
Okay, just like you mentioned there, the cost incurred in trying to pass a bill into law. The 8th Assembly worked on that insurance bill, and then they got it passed, sent it to the president for assent, and it got stuck there. And the 9th Assembly is beginning to. So, but I think that would be a topic for another day, looking at the cost, of getting a bill passed into law. So the public hearings, all the stages it goes through, money is spent.
Money is spent.
Yeah. Anyway, we've been talking to Dr. Laz Eze. He's the chief executive of talkhealthniger.com. Thank you so much
our
for
pidgin English.
Exactly, but it's a very catchy one.
Yeah,
thank you so much for joining us on the program Business Now. And
thanks for having me.
Yeah, we hope to have you some other time.
It's my pleasure.
Thank you so much. It's how we wrap it up on Business Now. Thank you so much for joining us. Don't forget to join us same time next week. My name is Chinaemerem Joseph. Bye for now.